Good evening, everyone, and welcome. I am Zaf Tandoktu, and it's a pleasure to chair this UROWebinar about public awareness of urinary tract infections and the fight against antimicrobial resistance. This webinar is organized by the European School of Urology, put together by bringing together the EAU Guidelines Office, the EAU sections on infection in urology, the patient office. As you obviously all know, and the reason you're here is that we do know that urinary tract infections are among the most common bacterial infections worldwide. Now, while often it could be misperceived or mispresented as a minor, they do carry a major public health impact. Misunderstandings about UTIs frequency lead to unnecessary use of antibiotics. And now with antimicrobial resistance, it's responsible for millions of deaths globally each year. That's a burden that probably none of us can really ignore. So tonight we will be focusing on, I could say, three things. One, the misconceptions about urinary tract infections. Second, antibiotic misuse and resistance. And the third would be about better communication with patients, public. But beyond that, probably the whole purpose of that will be how can we go ahead and work together. So without going any further ado and extending this introduction, we are fortunate to have two excellent speakers. They will guide us through both data and patient perspective here. I will first, for our first speaker is going to be Professor Gernot Bonkart, who's the co-chair of the EAU guidelines in infections. And we also are very fortunate that Jane, who is based in Netherlands and is the chair of the Painful Bladder Foundation, has agreed to join today's webinar. We have an excellent panel, and without any further ado, it's my pleasure to introduce our first speaker, Professor Gernot Bonkart, please.
Thank you very much, Thaber, for these nice words of introduction. Thank you very much for having me in this nice webinar, and I would like immediately to start with my presentation. So let's get started. So before we start with this content, I would like to briefly introduce myself so you know who is speaking to you now and why this topic is so important for me. After this, I will walk you through the presentation, which I've broken down into two parts. First, I would like to ensure that we are all on the same page. I will give you a brief overview about the clinical basics of UTIs. And then you will see just the next few minutes, hopefully, will be enough to perfectly equip you to answer the upcoming questions correctly. And it really highlights just how vital the right information to the patient is. And then for the second part, I'd like to make this a little bit more interactive. We are going through the central questions from the survey. And your job will just be to answer them mentally as we go, and something I'm confident you will then find quite easy after the first pass. So let's get started with my introduction. So my name is Gernot Bonkart. I'm 55 years old, born in Germany, married, one daughter, one wife, one dog, 5 brothers and sisters, and my parents are still with me, which makes me quite happy. And I'm a board-certified urologist with a particular interest in urological infections. And I live in Switzerland, exactly in Basel. And Basel is a nice city. It's located at the crossroads of Switzerland, France, and Germany. And it's the third largest city in Switzerland with 180,000 citizens. It's well known as Switzerland's cultural capital, and Basel is known as well for the Art Basel, and we have a university, which is the oldest university in Basel, and then, of course, we have this major hub here in Basel, Switzerland, for this chemical and pharmaceutical industry with global companies like Novartis, Syngenta, and Hoffmann La Roche are headquartered here in Basel. Basel is famous as well for its carnival, and this carnival is an UNESCO-listed event, which is really a unique experience. And here you have some impressions how it looks like. If you have the possibility to join it, then it's a nice experience. And I work personally in my own private practice. The name is Alter Euro, and we are a team of 5 board-certified urologists and supported by a dedicated staff of nurses and secretaries. And in addition to my work in private practice, I'm also a member of the academic staff of the University of Basel and actively involved in urological associations and guidelines. And since 2015, I have the honor to serve as chairman of the EU guidelines on urological infection. And this panel is one out of 16 panels that cover the entire spectrum of urology. And the EU guidelines are endorsed worldwide by many national societies and scientific organizations. Coming to urinary tract infections, and the urinary tract consists of the kidney, the ureters, the bladder, and the male accessory glands. And you don't have to be a doctor to understand a simple medical term that the suffix itis is meaning infection. So if you just add it to bladder, cystitis, and you have infection. So every time you have itis, then it's an infection. You can see in the urinary tract, you can have affected the kidney, the bladder, the ureters, urethra, and the male glands. And usually the diagnosis of a UTI is straightforward. It's simple to identify, but sometimes it might be a little bit tricky, especially in older people and children. UTIs can range in severity from a simple UTI, a cystitis, unto a life-threatening urosepsis. And in 25, UTI is a hot topic. And this is on the one hand because of the global burden of UTIs. So we are estimating about 400 million cases worldwide, and even 250,000 people are dying because of UTIs worldwide. And this is mainly because of the high rate and increasing rate of antimicrobial resistance. And this is meaning that the combination of the high frequency of UTIs and antimicrobial resistance is posing us for a real threat. It's creating a perfect storm, and we have definitely to keep this in mind for the next years. The high interest in UTI is mirrored as well in the increasing interest of the past years in our urological sessions during congresses. And if you consider that our guideline on urological infections with over 70,000 downloads is the second most of all guided or downloaded guidelines from the AIU, you can see which impact this field in our urology community has. And finally, we made it up to this urological week as a hot topic. So we need to talk about UTI. Starting with cystitis, perhaps you know that cystitis is very common. Up to 40 to 50% of women will experience a UTI, a cystitis, in their lifetime. And there are women affected more than 2 times in 6 months or more than 3 times in a year, which is defining a so-called recurrent cystitis. Pathophysiological, this cystitis is mainly caused by your own gut bacteria, mainly E. coli. They are entering the bladder, then they adhere to the surface of the bladder, and then they are creating this infection where you have these typical symptoms like burning, high frequency, urgency, etc. And the cystitis is not just a bladder infection. So everyone who had a cystitis knows that you have symptoms, you have restricted activity, you are on sick leave, and perhaps you have even to stay in bed for a few days. For the diagnosis, the clinical symptoms are guiding us, but we can use dipstick or urine culture as further means. And how to treat a cystitis? So we have 2 options. We have antibiotic sparing strategies and antibiotic strategies. Antibiotic sparing strategies would be, for example, an increase of your fluid intake. Drink water. You can use some painkillers. you can use phytotherapeutics. But if you use this non-antibiotic strategy, you have to be aware that you might develop an upper urinary tract infection, a pyelonephritis, 5% risk, and so you just have to be aware about it. Regarding the antibiotics we can use, I would like to refer to our current guideline. And you see that one drug is missing here, and this is a group of so-called fluoroquinolones. This is a drug that should not be given in cystitis. It's very important because of the side effects. Coming to the prophylaxis, so if you have recurrent cystitis, you have again different means. You can have or work with antibiotic sparing strategies, antibiotic prophylaxis, and then we have some experimental strategies. Behavioral measures are good tips. Sometimes they are called like myths in our field, but here's a short video summarizing a few tips. No scientific proof, no guarantees, but perhaps helpful. All right, this has been my 10 tips or advice, but we have more evidence as well. So we know if, for example, you drink not over a liter a day, then if you increase your fluid intake about 1.5 liter, then this might be helpful to prevent for UTIs. Then we have this methenamine hippurate, a new drug. It is an old drug, but newly used as well as prophylaxis means. Then we have the phytotherapeutics, the cranberries. Then we have local estrogens. We can work with demanose, a special sugar which prohibited E. coli to adhere to the bladder surface. And then we have immunoprophylaxis means. And antibiotics we could give as well as prophylactic, but this should be the last line. Here summarized as well in our European guideline, and just to highlight, we have a good evidence for the estrogens, the methenamine hippurate, and the antimicrobial prophylaxis, and the other means I have not such a strong evidence. To summarize our knowledge now, we know urinary tract infections are highly common, and the cystitis is the most common presentation. We know that women are more affected than men, and in uncomplicated cases, is the diagnosis primarily on the assessment of typical clinical symptoms. Treatment strategies for cystitis range from supportive care, increased fluid intake, and analgesics up to the therapy with antibiotics. And of course, you don't have to go straight to an antibiotic, but please keep in mind that you have a little bit higher risk for problems if you not do so. Coming now to our international survey. And the survey means bridging the gap from these clinical problems of UTIs to the public perception. And our question is now, how well informed is the general public? And I would like to start with the first question. Which of the following best describes cystitis was the first out of 9 questions? And you see that more than 1 in 3 people don't know what cystitis is. In Germany, it's high as 2 out of 3. But just to defend a little bit my German citizens, brothers and sisters, so for example, in Spain and Italy, cystitis is a term for bladder infection. So this might be an explanation for this high rate of knowledge in Germany. The next question, which of the following options is the main cause of UTIs? And if you have listened to me, then you could answer it. Yeah, bacteria entering the bladder, you know, but in the survey, 1 in 6 people don't know the main cause of UTIs, with some incorrectly blaming it on stress or spicy food. The next question, which of the following are common symptoms of UTIs? Now we have this urgency and we have this burning sensation. And in the survey, only 2 in 5 respondents could identify all 3 common symptoms of a UTI. Now you can. The next question, which of the following can help prevent UTIs? Try to remember what I've thought. And here is the answer. And this correctly could only be answered by only 1 in 5 people is aware of the 3 correct ways to help and prevent UTIs. Out of the following groups, who is most likely to experience UTIs? You know now, women are more affected than men, but the survey said that only half of all respondents correctly identify women as the group most likely to experience UTIs. The next question was, how many UTIs do you think can get better on their own without antibiotics? So this is right about 30 to 40%. And this question has been answered like this. And as a comment, only 1 in 6 people mistakenly believe that antibiotics are always necessary to treat a UTI. What percentage of UTIs do you think are becoming harder to treat due to antibiotics becoming less effective? This is a problem of antimicrobial resistance. And this answer was answered in this, or the correct answer was not found quite often. Almost half of the respondents either underestimate or are unaware of the growing problem of antimicrobial resistance. And then it has been asked as well whether the people who have been asked have ever experienced a UTI, and most of them, or about 50% of all respondents, have personally experienced a UTI, so they should have some knowledge about it. And then we had this question, how much has a UTI affected your daily life? Or if you've never had one, how much do you think it would affect someone's daily life? And here you can see that people who never had a UTI are 5 times more likely to think that the UTI would have no noticeable impact on a person's daily life or mood in comparison to people who has already had an UTI. They know that it will affect. And to summarize, that this survey across 5 European countries revealed a critical lack of practical knowledge. Less than half know the key prevention method of wiping front to back, for example. This is compounded by a dangerous myth with 17% believing unprescribed antibiotics are a valid preventive measure. And the severe impact on daily life is also underestimated 5-fold by those who have never experienced a UTI. And this data proves an urgent need for education to improve prevention and communicate the seriousness of this common illness. With this, I would like to close and send my best regards from Switzerland, and looking forward now to the further session. Thank you very much.
Thank you very much, Gernot. Very comprehensive, but just to the point. Beautiful. There's quite a few questions from the audience. And before I share my own questions with you, I'll try to share a few of them with yourself from our audience. This one I think is quite interesting, so I'll bring it to our attention. Do you recommend iodine solution application for UTI without fever? Probably we will know the answer that this is not recommended in the guidelines, but probably we should hear it from yourself.
No, thank you for the question. I have indeed some patients. They are using this as a prophylactic means, but they are not happy. It's not working. And I think personally it's harmful to your bacterial and microbial flora, which you have in your private parts. So I would strongly speak against this. Please do not do so.
Completely agree, Gernot, and that's why I wanted to highlight this question. I've also heard about a practice where Iodine has been used to treat urethritis and wash out of the urethra to an extent. Obviously, there's no evidence, and it's not a thing that we would recommend. It can be quite toxic to the urethra also.
Exactly.
So there's a few more questions, but whilst I try to summarize those, I had one question for you,
Yeah.
and that's a bit putting each other on the spotlight
Yes.
here. A lot of questions in the survey. If you could turn one of these survey findings into a simple public health message tomorrow, which one would you choose? Or nowadays it's like short messages, so we have 2 or 3 if we wanted to.
So one message would be, of course, that I would like to highlight the high frequency, the high occurrence of UTI. And with this, I would like to highlight as well that the population, or especially men, for example, could understand that the cystitis is just not a bladder infection, that it's affecting the daily life and the health of the woman which is affected with the UTI. It's not just simple. They are suffering from the symptoms. This is the first. The second, I would say that it's always important to counsel the patients regarding the non-antimicrobial means of the treatment. So you can live or you can have a UTI and it will go away in a high percentage, even if you don't take an antibiotic. And the third would be that if you have a question, try to inform yourself. And we have good means nowadays. Perhaps we will talk a little bit later about it. So I've heard that no one is, so from the younger generation, is using Google anymore. They are all using AI, and then I can recommend. I've tested myself. So if you have a question, you can go. But in case, don't believe 100% of the UTI. The doctor, your doctor, is there for you, as well like the AIU, the Patient Information Office, and there we will give our best to inform everyone.
Brilliant. I'll take the second point you highlighted about non-antibiotic options. And I think in the survey asked how many UTIs can get better without antibiotics. What does the public think about that? And how does it compare, let's say, to clinical reality?
So I think in the survey it was not quite clear what the answer was. So there was a high percentage that believes that you need definitely antibiotics that the UTI is correctly treated. But in my own experience, it depends, of course, a little bit on the symptoms and what the patient would like to have. So, for example, if you have a severe form of a cystitis with bleeding, high pain, then you, of course, I counsel the patient and say, okay, you see, you can avoid taking antibiotic, but in your case, perhaps it would be a good idea because then the suffering will definitely end in a shorter period. This is what we know.
Gosh, there's been a big burst of questions, which I will summarize when Jane is talking and try to find the common patterns between those questions. So I'll leave those for after Jane's talk.
Perfect.
But one question that strikes is, how can we better communicate epidemiological data on antimicrobial resistance? So there were questions about antimicrobial resistance awareness.
Yeah.
What does that mean? Difficult to treat infections are the key words that come to my mind.
Yeah.
Is there a better way we could communicate what this means rather than an abstract concept?
So this question could fill a meeting over a weekend. So this is a
Yes.
great and important question. But now speaking about our UTI or cystitis topic, I can say that if you use the antibiotics we are recommending, for example, the fosfomycin and the nitrofurantoin, we have, despite these drugs are quite old, more than 50 years, we still have very low resistant rates. So I always say, please do not worry too much about antibiotic treatment than for your cystitis. Of course, I take it serious and I know that even a short period of antibiotics might have some effects. But on the other hand, I think that we, with the treatment of our cystitis, are not the main drivers with the problem of antibiotic resistance. These are general, so we have discussed in other fields in medicine. We have as well then the animal farming
Thank
to
you very much,
discuss.
Gernot, putting that into context. Yeah. So
Yeah,
thanks for putting that into the context of UTIs. I'll summarize the questions from the audience at the end of after Jane's talk. Thanks a lot, Gernot.
perfect.
And now I'd like to invite Jane for her talk about the patient's perspective, the need for targeted education, please.
Yes, well, I'm going to be talking from a patient perspective about the need for targeted UTI education. I'm actually chair of the International Painful Bladder Foundation, but I'll be talking about UTIs and not ICBPS today. Well, a urinary tract infection is not a minor disorder. It can cause significant pain, pressure, or burning in both the bladder and the urethra, with a frequent need to urinate, often with fever, chills, fatigue, and nausea. And if the infection spreads to the kidneys, it can become a dangerous, even life-threatening condition. UTIs can seriously disrupt daily life, school, study, sport, work, home, relationships, and social life. Women and girls are most affected due to their anatomy with a short urethra and particularly the close proximity of the anal, vaginal, and urethral openings. Nevertheless, the problem receives far too little practical attention, including from urological and gynecological societies, and there's too little effective, down-to-earth publicity. Public awareness campaigns remain limited, and they're often hindered by the social taboo that surrounds bladder and urination problems. Publicity and education need to be tailored to several quite different groups, which include teenagers, parents of teenagers and of younger children, adults who are aged 20 plus approximately, the elderly, and the elderly in care. Teenagers are today a crucial target group. Many, often very young, are sexually active. They find this normal, it's cool, it's part of their trendy social scene, but they appear to be quite oblivious of the risks of bladder infection. They may know something from school about sexually transmitted infections and pregnancy risk, but the information they receive about safe sex does not apparently teach them how poor hygiene plus sexual activity can allow bacterial infections to enter the bladder via the short female urethra. Now, unfortunately, many young people today may have been watching online sex pornography, which gives them the impression that sex has to be very athletic. And this further increases bladder infection risks when combined with inadequate urogenital hygiene. The further dangers of kidney involvement or chronic bladder damage, even for the rest of their life, never occur to them. And for this reason, tailored practical education is urgently needed, not only for teenagers, but perhaps also for their parents, who may lack this knowledge themselves. Another neglected risk group is that of elderly people, and again, especially women who may suffer from bowel incontinence or experience diarrhea leakage, which can easily allow bowel bacteria to penetrate the nearby urethra and then straight into the bladder. UTIs are very common in this elderly age group, but often present with atypical symptoms, and that can also cause problems. And while women remain more affected, men tend to catch up after the age of 65, often due to prostate enlargement and catheter use. And this highlights the need for sterile, no-touch catheters. And I personally believe that catheterization must be kept as sterile as possible for the sake of the patient. These elderly people need practical advice about self-care to prevent infections, understand the risks, and to recognize the signs of a possible infection. Another important elderly group comprises those who are physically or mentally incapacitated and unable to care for themselves. They may be in care homes, nursing homes, or still living in their own home, often alone and reliant on home care, which may or may not exist and may certainly be inadequate. With healthcare cutbacks surging across Europe, and undoubtedly more to come, ensuring that sufficient time is available for proper urogenital hygiene in care settings is becoming an urgent concern to avoid infections and reduce antibiotic use. Is sufficient attention being paid to urogenital hygiene in this specific elderly group? Do we need more information for carers on the risk of UTIs? Different age groups need specifically targeted approaches, as their problems and risks may considerably differ. And advisory committees for this purpose should perhaps comprise doctors, nurses, home care organizations, patient organizations, and especially representatives from the age group concerned, but very importantly, publicity or communication experts who understand how to reach each group effectively should be involved too. And where teenagers are concerned, we need to know what information is or is not being given right now in schools, and if it is, at what age? What is the most effective way to approach them, and at what age exactly? An official educational YouTube video is perhaps needed for teenagers and aimed at both girls and boys. After all, it takes two to tango. Since we're talking about a medical problem with social issues, the information needs to be medically approved and practical, but also meaningful for trendy teenagers. And this video could also be used in schools. And maybe something can be learned here from the ketamine campaigns, which have also targeted teenagers. Where the 20-plus aged adults are concerned, you could provide targeted media and video resources focusing on perhaps lifestyle, hygiene, and awareness of the risks, and especially how an infection can occur. For the elderly and carers of the incapacitated elderly, you could create simple, accessible educational videos, handouts and guides addressing hygiene, infection prevention, and care strategies. And is better training required for carers and care homes about urogenital hygiene? In other words, more than just giving them a handout or a leaflet. Overcoming the social stigma around bladder health is essential. a large-scale educational campaign across selected media, including online platforms, magazines, schools, healthcare settings, combined with downloadable resources, handouts, and perhaps parent-educator guides, could potentially make a real difference. By addressing each age group with clear, practical information with no taboos, we can raise awareness, prevent unnecessary suffering, and reduce the number of infections. Thank you. That's it.
Thank you very much, Jane. Thanks for the great summary, actually. Now, before I head over to the questions that I wanted to ask you specifically about the talk you just gave, to our audience, I'm trying to reply to your questions in the live chat. Please check for the answers I'm typing through. I do apologize if I cannot get through to everyone. We'll try to do our best. I'm trying to also identify the common patterns between your questions and squeeze them into one single question. Jane, I have a couple of questions for you, and I think your expertise will be quite helpful for us. From your perspective, I think you covered it slightly, but I want to bring it to the forefront. What is the single biggest challenge in communicating about UTIs to the general public?
Well, actually, I think there are two challenges. One is the social taboo on talking about urination issues. And particularly in men, people don't seem to mind it so much. In women, that people don't mind it so much in men. You know, you can see a man peeing against a tree and nobody thinks anything of it. But if a woman takes her knickers off and squats down, it's horror everywhere. A second challenge is that women and girls are most affected, whereas the urology world has been focusing increasingly on men's urology problems, with women's bladder issues largely sidelined, and with the teenage group, I think, completely overlooked. I think we're now seeing some movement in communication, but it's so far only very limited.
I understand. So am I hearing that this is not only about urinary tract infections, but it's about more about the bladder health, we could say, also? They overlap I see a Venn diagram where they cross each other.
Yes, I think you have to look at it, the big picture.
Yes, yes.
And there's more coming out now, more attention being paid to inflammatory bladder disorders.
Yes.
And of course, if you get a UTI in one of those, you've got a major pain problem.
Exactly. So I think at this point, what we're providing as an example here is that me as a healthcare professional and yourself as a patient advocate, we demonstrate how we come from very different angles, obviously, about this. And then my question will be, well, how can healthcare professionals and patient advocates like yourself best work together to close these awareness gaps, let's say? I mean, we already at EAU have a patient group, which is fantastic, which is why we have this webinar today. But there's more to be done.
Yes, well, as I already mentioned, I think there's a third important partner, and that is communication experts who really know the best ways to approach the different generation groups. So I would say you need healthcare professionals, patient representatives, and publicity communication experts in committees. Now, our problem is that, as far as I know, there are no patient organizations exclusively focused on urinary tract infections. And if this is indeed the case, maybe we have to do something about this. However, I should add that many bladder organizations for specific conditions do include some mention of UTIs. but maybe we need per country one organization for UTIs.
I think you highlight a good point, UTI groups. And to my knowledge, there is the chronic urinary tract infection campaign, which I'm not entirely sure who it's led by. They could be potential partners probably to work together with, alongside the communication experts you have mentioned.
Yes,
Um,
yes. I think if the EAU could produce some really reliable, downloadable stuff, leaflets and whatnot, fact sheets, the other bladder organisations, I'm for the IC patients, but there's for bladder and bowel and all sorts of things, they could download them and start a campaign. But it's very important that the information that's provided, especially to teenagers, is absolutely correct.
exactly. I would like to at this stage invite Gernot also to the discussion. I was going to pose the following question on how can we improve the awareness of when it comes to detecting UTIs in the elderly, which is a group that Jane highlighted. And I would like to hear, I mean, it's a group where symptoms can often be subtle, maybe, and overlooked sometimes. And alongside lower urinary tract symptoms being quite common in this population, how would we navigate or increase awareness, at least in this group of population, that we can detect UTIs sooner?
Yeah. So it's a good question as well, because we have to discuss two topics. One is that in the elderly people, we often have bacteria in the urine without an infection. We call it asymptomatic bacteria, and we know that this is a condition that should not be treated. But then we are facing the problem that sometimes, for example, the older patient might be deorientated because he is not much enough fluid intake, or he just has lost his glasses and he cannot see. And then it's concerned in the nursery room that there's some deorientation. The patient is brought to the hospital, to the emergency setting. The urine is tested and then see that there are bacteria. And then the patient is treated for a urinary tract infection, but he has no infection. He has a completely other problem. So this is really something we have to focus. But unfortunately, this could only be done by education. This is only experienced by the treating nurse. And I know so many great nurses have the experience. They know that not every symptom might be related to an UTI. But of course, this is a challenge. This is why we need experts as well. It's not so easy.
Absolutely. And a buzzword I heard here is that change in cognitive function, essentially, in the elderly population is one thing that is keep being highlighted. Jane, is there anything you would like to add on to this discussion?
Well, I'm very concerned about cutbacks in care, especially home care today. We're certainly seeing it in the Netherlands, and I'm sure it's in many other countries too. And a lot of elderly people are being forced to stay in their home. There's no place for them in a nursing home. And if they're not getting enough help and care, their hygiene may be distinctly lacking. And you know, elderly people, for heaven's sake, I'm one myself, I'm 80, so I know the group very well. They can be suffering from the bowel incontinence I mentioned. And you know, in no time that's got into the urethra. And the bowel bacteria is a very common cause of a UTI.
Absolutely. Yep.
And so I think there's got to be more emphasis on hygiene. I don't quite know how, but I'm sure that the nurses and care home organisations, they could come up with some answers how this can be done.
Understood. So a key message here would be how to improve hygiene, probably, which is directly linked into urinary tract infections. Now, I'm becoming acutely aware that our time is limited. So with this session, there was, however, one key question that Gernot wanted to answer, if that's okay, Gernot, with you. I'll leave that with you at the moment.
Why is fosfomycin still recommended as a first-line treatment for urinary tract infections? Shouldn't it rather be preserved for cases with multi-drug resistant bacteria, especially given that nitrofurantoin has been shown in some studies to achieve higher eradication rates? Doesn't convenience risk outweighing rational antibiotic stewardship, particularly when fosfomycin may be crucial in managing multi-drug resistant infections? Excellent questions. So I would like to answer the following. So we have options for antibiotic treatment of cystitis. One is the nitrofurantoin. The other first-line recommendation is the fosfomycin. What is the advantage of the nitrofurantoin? The nitrofurantoin is working excellently in the urinary tract because it's 100% reaching the urinary tract, but the disadvantage might be the lack of tissue penetration. But in selected cases, for the so-called uncomplicated cystitis, it might be a good first-line option. To discuss what might be the advantage or why it is still first-line option. Okay, it's user-friendly and we have a very good resistance profile and we have only a few side effects that has to be considered. So I would say for a young woman, nitrofurantoin might be a good option, but we have to keep in mind, especially for the older generation, that nitrofurantoin has some severe side effects, at least we have to consider. One would be, for example, pulmonary problems. So if an older female patient has, for example, already some problems with the lung, we should consider it. Then we have problems sometimes with the liver, or if the kidneys are not functioning so well, this is putting the fosfomycin a little bit in front of the nitrofurantoin. But I think, in my opinion, both are excellent options. If you would like to argue that nitrofurantoin has shown a little bit better results in trials, then we can discuss about the trials. And then, of course, I think we will end up with a 50-50 decision. And so I would recommend, so if you could choose and if you have not to fear the side effects of the nitrofurantoin would be a good first option. But fosfomycin, in my thought, is just a little bit behind. But of course, you are completely right. The fosfomycin might be an option for more severe systemic UTIs. There you can give this drug as well because of the good tissue penetration and from means of antibiotic stewardship, that even if the resistance rate still today is low, it might be good to save it for the next years, next generation. So I can completely agree with it.
Thank you, Gernot. And one message that I can see in the chat is that for nursing homes, a message that can be delivered is better hydration to prevent UTIs. Jane, that was something that the audience also has brought to our attention, which I think is quite relevant. Therefore, without any further ado, please, for our audience, thanks for joining us and keep track of the next session in this topic. I'm very delighted to see such a big interest. Thank you very much for both our speakers. Jane, thanks for sparing your time and coming here today. Gernot, thanks for sharing your expertise. And everyone, thanks for joining. I just will summarize the session in 2 minutes. We've heard that urinary UTIs are quite common, but the understanding in the public remains quite limited. And these awareness gaps can lead into anxiety, unnecessary consultations, overuse of antibiotics, or it can directly fuel the burden of antimicrobial resistance probably. But it's important to underline that UTIs are not just minor conditions. They can have major impact on daily life and in some cases serious complications. So recognizing this helps us to take the problem more seriously. not only from a medical perspective, but also how we communicate with patients and the public. One last point I want to make is that we've also learned that different groups by age, gender, and background have very different levels of awareness, but also there's very different presentation of UTIs, how they present themselves. So the awareness for each population should be different, such as the elderly, as Gernot highlighted. Change in cognition can be an early sign of a severe urinary tract infection. So on behalf of the European School of Urology, before any further ado, and the EAU Guideline Office, EAU sections of infection, and the patient office, I would like to sincerely thank both Professor Gernot and Jane joining us today. And thank you for your participation. Have a lovely evening, everyone.